I thank Edith for her introduction. I'm hoping to have to express a paradigm shift in the concept of looking at mental wellness, mental illness, as Edith talked about in parenting, and the concept of energizing a relationship, what we have to give. And talking to her, I'm hoping to, to see what she thinks about the way I describe it, but really, biochemistry is where activity in the brain comes from. And so we can think about biochemistry moment to moment, but we can also think of it long term. And I have a slide on that. It's on temperament. And so really, I think to some degree, what I'm going to be talking about is how we can look at someone's temperament and look at biochemistry, but also look at their biochemistry and know what their temperament might be. And that really does help us a lot as parents and as professionals in helping people that have problems in mental wellness, be it depression, aggression, or something like that. I started down this path because my son was diagnosed with autism. That was 10 years ago. He was pretty severely affected, nonverbal, tantrum about 6 hours a day, and was really unhappy child. And we were told there was nothing you could do for him, and that was really untrue. There were behavioral therapies that could be done, which we did start to do, but it turned out there was medical care that could actually really help him as well. And that's really where my whole practice in integrative medicine came from, that shift from traditional medicine to what I do today. And so my history is I was trained in general medicine. I did my pediatric residency at the University of Utah in Salt Lake, and I did 8 years of general practice, 7-8 years of general practice in Salt Lake before I moved to Montana. And about that time, my son was born and 2 years later diagnosed with autism. And we did things with him in Montana to help him home-based behavioral therapy. But it was clear that as he was improving, which was a miracle in and of itself, that what we needed was more. And just so you know, one of the reasons I came here is because this is one of the best places to be if you have a special needs child. The most important thing is not necessarily what I do, but it's the fact that where the rubber meets the road, behavioral therapy, educational strategies, all the paraprofessionals, it's that entire depth of care is what they really need to actually improve. And in Ohio, especially in the Columbus area, there's many people that have had a lot of experience in taking care of these kids. You just can't pick up somebody as ill as a child with autism and learn as you go. Now, I did that for 2 years, but 2 years is the point that I couldn't learn fast enough anymore for my son to actually help him. And I had 7 years in Chicago as medical director of the Pfeiffer Treatment Center. That's where I met Edith. And I treated adults and kids there, and we treated severe mental illness to autism, so schizophrenia, depression, bipolar disease, ADHD, autism. And that was very, very helpful because when I see people's behavior, I look to what their chemistry is. That's what I say for short for biochemistry, and I'll get into that. But and the people in the office start to notice that we start to see one's chemistry. It starts to give us insights into their temperament, as I said before, and the way they are. And I learned that in a whole variety of different presenting symptoms. So schizophrenia is very different than something else. But it's interesting, they're the most responsive to the nutrient therapy that we treated with. And then I eventually came here. After doing just subspecialty care and mental illness, it was time for me to really go back to my roots and do wellness too. And so I do both well care, but the predominant patients that I have are actually ones that have special needs. And so people often ask me, what is integrative medicine? In my mind, integrative medicine is what medicine was, and allopathic medicine, another way to describe what we have in Western medicine today, is unfortunately what happened when we lost some of the important parts of medicine, which is looking at the entire person, mind, body, and spirit. So as we've gone into this more supposedly scientific realm, we've lost the human realm of medicine. And so integrative medicine is incorporating, reincorporating, or really paying attention to that whole mind, body, spirit of the individual. The key thing, and Edith even said this, is kids want to develop normally. They want to succeed. They want to master what's going on. They want to be able self-sufficient. And when we see certain behaviors to us, they may be maladaptive, but they're adaptive to the children in as much as it helps them with whatever that root problem is. And that's what we want to talk about at a chemistry level, is why might they have specific abnormal behaviors that if we remove that root cause, we don't see the behavior anymore. So in many ways, when I talk about doing someone's chemistry, I'm actually trying to unlock the full learning potential of the brain. So my goal is to make it so that kids can actually access all those other strategies, education, psychotherapy, whatever, access them and succeed so they can move on, catch up their development, be able to mature their brain, develop, healthy coping strategies actually to success in life. But in integrative medicine is also using natural substances if we can. So most of the things I use are nutrients, so vitamins and minerals. Though I do meds too. Meds have a place. But the idea is that there are many ways that we can approach a problem, and the better we understand it, more likely the safer way we'll be able to intervene for it. And I apologize for the two busy slides, but there's something that you can read later. But the concept that integrative medicine really is embodying or encompassing is this new move towards systems biology. And thankfully, that is part of the scientific resurrection of integrative concepts. And that concept in med school now is that all systems are interrelated. So everything's connected to everything, the bold part on the bottom of the slide. So we can't look at the bowels separate from the brain, separate from the lungs, separate from the heart, because they're all interconnected. And we know that too, because we don't just feel emotion with our brain, we feel it with our heart. In fact, maybe we actually feel it in our brain because our heart tells us how to feel. So it's the question that's, where is the origin? The origin is in the whole person. And especially in a place like this, we know that spirit is a very important part of that too. So what would I like to talk about today? Basically, to get a different perspective on this concept of wellness, mental illness within the biochemistry perspective, use two common things we see today, ADHD and autism, as diagnoses to think of in a different way. Not in the way that traditionally they're viewed in current medical practice, but how we might view it if we did it with an integrative perspective. And look at some of the basic treatment options, and then just present the concept of mental wellness. So, as I said before, we really want to understand, better understand what we're dealing with. And so we can look at it different ways, and one of the things that's very important for integrative medicine is to really look at the patient's perspective, the family perspective. So clinical manifestation, we could look that specifically up in a book and say, well, abdominal pain, it hurts right there if you have appendicitis, but, what does it mean for the kid? Well, my stomach hurts and it hurts bad. We need to get the emotion in there. We need to get the way it really affects the individual. And then the professional perspective is back to this scientific piece of what's going on, the diagnostic criteria. But really, if we were to take the full integrative look at what's going on, is we're looking for the incoherence, so the absence of coherence in many systems and the individual. Now, I'm going to mainly talk about physiology, the bottom part of the slide, biochemistry, but let's think back to how abnormalities in our physiology can affect our spirit, can affect our cognition. And I almost used the word default instead of behavioral expectations, but I wasn't sure people would understand that concept, the default setting like there is on a computer. What's our default temperament? What's our default behavior in any one situation? Hopefully we can change that. Now, similar to a computer, you can get a processor upgrade or you can get a new software. Well, new software doesn't run on an old machine. So that's where chemistry gets into play, so that actually we can give the brain, the individual, the whole system, a new CPU so that we can bring in the new software so that it actually functions. And I'm not saying that, just getting a getting a new hard drive is going to fix the machine, but it does make it much easier if you have memory, if you have the time to listen. You have actually the ability to take something in and learn it. So we'll look at some of these different systems, but mainly we're going to be looking at physical systems. So again, not to get too complicated in the concept of how we look at things, but it's also in the body, when we think of the brain, it's sometimes just not one part of the brain. Okay, it could be the whole brain that's affected, but it may be specific regions of the brain that are affected. When we look at metabolics, we can look at something called oxidative stress, which I'll mention several times. Basically, oxidative stress is free radical damage in our body. Our bodies are rusting. We have an ability to resist rusting, but gradually rusting over time does win out. I think that's one way to think of aging. But if you get rusting at the wrong time, it could affect your development. Oxidative stress is one way we describe, at least I describe, what happens in autism. Just to step aside, the similar genes, I think, that affect Alzheimer's also affect autism. It's timing of insults now that lead to oxidative damage of the brain that then would bring out autism. Before, people that are now 60, they were raised in a relatively less toxic environment than today, so they didn't develop autism. Were they 5 today, they might have autism. They probably would have autism. If it's the other way around, the kids of autism today, if they were 60, would be having Alzheimer's, because they were actually raised in a less toxic environment, came forward and only accumulated over life. So oxidative stress is, again, one of those things we can look at in individual parts of the body, but also as a general explanation. Organ systems, brain, bowel, immunity, there's no reason, there's a good reason those are all on there. Those are the systems that I'm almost always dealing with in people that come to the office. And I'm going to talk about these individual biochemical pathways. Also, not to get complicated, but this concept is one of the ways that really helped me better understand my role in promoting wellness in people that come in with mental illness type of symptoms. And psychiatry, psychology describe illness among these 5 axial systems. One is clinical psychiatric disorders, which is schizophrenia, depression. Autism falls in this category. 2, I usually skip over. This is personality disorder. 3 is where I was trained. So I'm trained to treat axis 3 illness, if you think about it that way. Axis 4 and 5 are very important in integrative medicine because that's part of that environment that we're talking about. What are the psychosocial supports? What are the environmental challenges or supports that are going on? But really, axis 5 is how are they functioning? Because that's really where the rubber meets the road. That's what I talk about. When I'm doing nutrient therapy, I can do all these testing. I can say that this is what, the testing, my clinical judgment says needs to be done, but it really needs to be done if it works. We need to make sure that it's actually effective. But the one way I describe what I do to people, especially with the kids with autism, is because autism falls within the axis 1 realm, most people feel it's not treatable. When you're labeled with an axis 1 diagnosis, if you're labeled schizophrenic, you're labeled depressed, you're labeled bipolar, the feeling is there's really not treatment, or there's this strong drug to take care of it. Let's step back and think about what are the root elements of that illness, and those fall in the axis 3 realm, and that's actually what we're going to talk about. With those biochemistry, how does biochemistry affect the behaviors that ultimately allow the diagnosis? That's axis 1. And that's autism in a nutshell. Also, the other things I do. Why talk about mental wellness? Well, because it's the key to life, So we forget a lot of the times, that we're supposed to enjoy life, And as my wife reminds me, life isn't drudgery, even though I think of that sometimes in medicine day after day. At least if I get out, I did residency 20 years ago, I should have left it at the door, I guess. But it's happiness, physically vital, we're productive. I'm clearly more effective as a provider when I'm mentally well. So, that's why we talk about it. and it's fragile. This is the thing that's really scary. I was just talking to Edith. Why do kids not respond to traditional discipline? Well, because society probably had better structure to begin with. This is what she just told me. So they had better structure. So now that we don't have the same structure that we used to have, we have to parent in a different way. And again, it's effective. You know, that's the key thing. Is it's going to be more effective. But mental wellness is really fragile. This was taken out of one of the most well-known integrative pediatricians in the nation's book on mental wellness, actually, and mental health naturally. But it's pretty scary. 25% of adults have a diagnosable mental health disorder. That's an Axis 1 disorder. Okay? So that means 25% of adults are untreatable if you think within that general realm, or you need medication to take care of it. That's not true. Anxiety, and I'd agree with that. You know, most of the people that I see in the office, the kids too, you know, anxiety is one of their key symptoms. So I think this may be underreported, to tell you the truth. It's just, this is anxiety reported in one form or another, but I think there's a lot more internal anxiety altering behavior than actually has been identified and changed or altered. Then mood disorder, 10%. We know that in one's lifetime, 25% of the population will have a major depressive episode. So that's the Axis 1 back to the traditional diagnosis for depression. So that means, you know, we're going to have a period of time that whatever that balance that's going on in our brain is going to be depressive. Now, you don't necessarily mean you have to have a medication for it, but just goes to show you that, you know, mental health is fragile. It's also not constant. And so we just have to think about that. And I was just shocked at the last number. 25% of kids have problems that interfere day to day. Now, I guess it shouldn't have been a shock because you hear about all the challenges that are going on at school. But at the same token, we think of ourselves as generally mentally well. This says that we're not necessarily ill, but we're not functioning optimally. And that's the key part of really integrative medicine too, is we want to be, you know, living well, functioning optimally, enjoying life, you know. And when you look at the numbers on medication use in ADHD, it's just scary. I mean, if you look at the numbers, 1 in 6 births will have a neurodevelopmental disorder. So that's anything including as severe as autism or cerebral palsy that falls into that, or ADHD. And 10% of 10-year-old boys have been tried on a stimulant. That's pretty scary. Stimulants are not innocuous. You know, they have their negative effects too. And the biggest one is dysphoria or unhappiness. That's not commonly reported. We hear about stunted growth, decreased appetite, poor sleep, you know, the other things, but you don't hear about unhappiness. So it's not uncommon when I hear folks say that when they stop their stimulants, the kids are almost happier. So some of what we see as their improper behavior could also be the fact that they're unhappy, and the medication can cause that. So we have to look at, you know, really what are the positive and negative effects of any therapy. I try to be brutally honest, nutrients, meds, whatever we're doing, because I just don't want to favor one thing. I just want to say, okay, what are the positive and negative of what we're doing, anything that we're doing? Because the ultimate goal is to help that child. So what came first? Behavior or biochemistry? So this is the new part I added to this talk. Tried to explain to people why nutrients matter. And so it's pretty amazing. There's 100 billion nerve cells in the average brain with 7,000 connections per cell. And they fire 300 to 400 times per second on average. So that's a lot of electrical activity, if you think about it, or a lot of noise, potential noise in the brain, okay? And so, and it's really the balance of two things. A neuron can fire or it cannot fire, and it fires based on the balance of the input of one cell on another could be to tell it not, inhibitory, or excitatory is to fire. So it's a balance of those two things. But what's really interesting is no two nerve cells touch. So that although we have all this electrical activity, all that goes from one end of a cell to another, and that could be one that's in my brain and in my spinal cord, okay? But cell to cell, all signaling is chemical. So that's when you hear about neurotransmitters, those are the chemicals in the gap that go between two cells to tell one to fire or not fire. So that's where chemistry comes into play. So it's very fascinating if you think about it. So it's actually this symphony of both electricity and chemistry that really determine what's going on in our brain at any one time. And over the long time, too. Because there's memory in the brain. And the immune system itself, which is chemical, has memory, too. So there is chemical memory also. It's a different concept, but it starts to get into this integrative concept. And then when we talk about neurochemicals, people have heard about serotonin. GABA is another very important one. GABA is important because it's an inhibitory neurotransmitter. So remember, there's excitatory and inhibitory stimuli in the brain. 40% of the neurochemicals in the brain are GABA. So that means almost half of the brain's neurochemistry is inhibitory. So it's not so much action as sometimes inhibition that makes up behavior. And that's the other way I wanted to kind of describe it. So behavior then really is the output of the result of this symphony. So our current behavior is then the output of temperament with short-term factors in play. So that inhibitory. So the way I say it is action, inaction, inhibition, disinhibition. And so, we've heard, well, they're disinhibited. That's a problem. They drank too much. So social graces are as much inhibitory behavior as anything. And if someone disinhibits themselves, then they are actually doing things they otherwise shouldn't. So we could then take that to a step that long-term temperament, a person that default is anxious, that's disinhibited, is anxious because they're not inhibited. Okay? So, and we don't, and so this is the way, when I look at people, I'm trying to look to say, okay, what's their root problem? And so when we get into the chemical diagnoses, we can see that a lot of it is disinhibition, actually. And so that means what we're doing is giving barriers to the brain, barriers in behavioral modification, in thought processes, and cognition to allow our behavior to be what it should be. Temperament then, we could do a matrix, there's the color code. I was going to make a slide with some of the different things that you could do to describe behavior. But it's really a matrix of a variety of different behaviors, rational, irrational, forgiving, unforgiving, anxious, not anxious, tranquil is the better word. But, I guess the other is, what did Edith say? That, we close down on average, so rather, the forgiving, unforgiving might be we're not really going to let someone into our space. But the other is we're going to also want to have things our way because it's known to us. We're not going to be in a place that we're going to actually reach out. So let's talk about ADHD. It's got all sorts of different names. But we'll do the traditional diagnosis, and I'm going to go through it real quick. But then I want to put on the integrative thought. So when you look at ADHD, these are the diagnostic criteria. For inattention, do you have 6 or more of these for at least 6 months? If the answer is yes, then you have A. And then if you have 6 or more of these, then you have B. Okay, so hyperactivity and impulsivity. It's nice to look at those big 3 criteria because that's really what we're talking about. And then you add it up, and if you have A, you got 1. If you got B, you got the other. You got both, you got both. So that's, and these are all observational. That's one of the key things. There's no biologic markers in Axis 1. Okay, and that's one of the advantages for me. And what I do is I have biologic markers to actually help me make a decision about where we intervene or how we might intervene. Yes, go ahead.
I'm just curious, if that's so there isn't any test, per se, blood otherwise, to test the chemistry to show the imbalance?
No.
It's all
To answer your question, there's no test to diagnose ADHD by blood work. It's all observational. Same thing, diagnosis of autism is observational. You have these behaviors. You have this developmental delay. Okay? So that's what I'm saying is I can't diagnose ADHD, but what if I look at ADHD a different way? So your question is actually perfect for my next slide. No, it is. Is it attention deficit disorder or a deficit of net attention disorder? Okay. So the concept is, maybe we began with adequate attention, but we don't have adequate attention now for one of many reasons. And so I put some of that up there. Hyperacusis is can't tune out sound. So you could be very distractible because every sound makes you turn and change and shift your attention. If you've ever been very sensitive to sound, it can, you just can't concentrate. So, and Pyrrole disorders, and I'm going to talk about the things in parens I'm going to talk about, okay? But maybe somebody has adequate attention, but because of these chemistry reasons, which we can also describe as, poor memory, but zinc deficiency does that, are leading to ultimately the diagnosis. If you reverse then the cause for these energy-stealing things, these attention-stealing things, then we may not actually have a deficit of net attention. We may then have adequate attention, no longer then meet the criteria for ADHD diagnosis. So what's autism? This will be real quick, because it's usually a whole lecture. So what is autism? It's a medical illness. So this is, if you look at what's going on in autism, is they have a medical illness with a biologically impaired brain. So their brain's not functioning right, and there's both genetic and environmental reasons for it, epigenetic, that's also, or acquired factors. It depends on how I put it on the slide. But it's not just the brain that's affected, it's other things too. And again, illness is an energy suck for the brain. The brain only has so much capacity to deal with anything. So physical illness, mental illness, depending on the way you look at it, there's just all things that steal a finite amount of energy. As Edith said, all we can ever do is give somebody energy. But we only have so much energy at the beginning of the day. We can only generate so much energy throughout the day. We just only have so much energy for attention or wellness or being able to just digest food. And so it results in the abnormal behaviors that we then can diagnose, that also things that mean developmental delay. So it's a different way to look at it. And so I talk about it as a preponderance of autisms. So if you look at the diagnostic criteria, you'll see these things. Poor eye contact, can't regulate social interactions. If each of those little lists were an autism, if you just have too many autisms, you have autism. So if you get rid of the autism, you don't have autism. Okay, it's not, we just need to change it to a Z or something, just so you know what I'm talking about. But that's the general concept. If we can attack those individual behaviors that we see as autistic traits, then, and you don't have very many, then we'll help you. Now, the biggest challenge is actually the greater part that's also inclusive of kids on the spectrum, adults on the spectrum, is that real diminished emotional intelligence, emotional quotient. That's more than just an individual behavior. That's a whole other concept. I talk about that as a language in and of itself. So one way to think about why kids have so much trouble in autism is they don't understand the social emotional communication language because they don't have it. They didn't develop it naturally. It's like if I dropped you in a foreign country. You'd speak Pidgin German if you didn't speak German. That's what's happened to a lot of kids on the spectrum is they speak Pidgin emotional intelligence. We need to get them to the point that they can actually pay attention and see what's going on in the world around them, learn to interact appropriately with it, and then develop that emotional intelligence over time. That's the real hard challenge that goes on. So how do we look at this from an integrative approach? Well, we go back to that concept of what's integrative medicine, systems biology. So we're going to look at multiple organ systems. And we don't have a chance to talk about all of them. But the bottom one's really that interesting concept of psychology, neurology, endocrinology, which is hormones and glands and immunity. There's this whole concept of, our mentation tied to our emotional, physical, immune, endocrine state. So this is the topic that I love to talk about. I like to talk about the whole thing, but this is what changed my career. Is talking about how nutrients can really be a big thing. And I already said before, remember the brain is a symphony of electricity and chemistry. Chemistry comes into play in this way. We need zinc for GABA. If 40% of your neurotransmitters are GABA and you don't have enough, that means a lot of disinhibition if we talk in that other language. So that's one thing zinc gives us. It gives us other things too, and we'll talk about that. But we need vitamin B6 for serotonin. There's a lot of people that are on SSRIs which alter serotonin. Okay, we see mood improvements, anxiety improvements, OCD improvements with vitamin B6. And copper. Copper is an interesting mineral. In overload, it can lead to hyperactivity. So in that integrative diagnosis of ADHD, I kind of have to pull hyperactivity out of it, because when you have copper on board, hyperactivity is its own entity. When you see those kids, those are the ones that are like bouncing on every chair in this room during the whole talk. They just cannot not move. It's pretty interesting. You see it. So I alluded to this before. Going to the right of the slide, what I do is really targeted nutrient therapy. We're trying to find the couple few nutrient imbalances that need specific intervention. You can't go and get, a multivitamin and take a bunch because of what's on the left of the slide. Some people are deficient in some things and overloaded in others. You take too much, you're going to be overloaded. And that throws you into imbalance, and that has its own set of undesirable circumstances. So we're trying to find the right balance. We're great in America, little good's more better. It's the right amount. Fortunately, with vitamins, I got a lot wider range of dosing. I can do a little oops above and below, and it's not a big deal. Meds are a lot more touchy, if you know about it. You have to have the right dose. Vitamins, you do need to have the right dose, but the body has ability to process nutrients. It has mechanisms to do so. And remember, I'm not saying medicines aren't useful. I use them. They have a place. But they're much harder to use, really, than nutrients, if you think about it. So multivitamins don't usually work because you're not getting what you need. The doses are just not there. So always asked, can vitamins change lives? Well, you can see that day to day, absolutely. Well, me too. I have Pyrrole Disorder, I'll talk about it in a minute. But do they change lives? Yeah, well, you need a study. Well, this is the study Pfeiffer did, and I'm so glad they did right before I came on as medical director. It's an open label study, so it's not as good as a placebo-controlled study, so one where you give people, like a sugar pill, though I usually wouldn't give sugar to kids, but, but the question is, does it work? And this is the first step to going the full placebo-controlled side. And so basically, what we did is we looked at 207 behavior disordered subjects. So they actually had assaultive behavior, so they hit other people, or destructive behavior, which means they broke things. Okay, and this is kids and adults that were treated ultimately for the chemistries that I'm going to talk about. So it's not like we were just choosing one chemistry. The other thing too is when you do a lot of blinded placebo-controlled trials, you really narrow things down so much that to some degree you really, that makes it hard to do this type of work, because you can't narrow things down a lot of the times to just one nutrient. It's usually several. And you'll see that I have some clinical examples that it's rare you're going to find one chemistry. You're going to find one or two. So in any event, a couple things we learned from this. Taking a bunch of nutrients is hard. So that's why only about 3/4 could do it. One of the reasons where I worked had a pharmacy is because of this study. We're able to bring nutrients into fewer capsules. It's a little more costly, but compliance is worth it in some circumstances. So that's one thing we learned. But the other thing we learned is it works, which is big. Half, a little more than half, were symptom-free after a month. I mean, it's amazing. It's rare that you see this degree of success in medications for these behaviors themselves. And it's rare that behavioral therapy alone has that success too. It's both. And that's one of the things I want to stress over and over again. I just want to unlock the real potential of the brain to learn. I know that nutrients aren't everything, but they're a piece of accessing traditional stuff. And the partial improvement is an important thing too, because that could have been somebody that was beating on somebody 10 times a day, but still did it once a month, or once a day, or once a week. Going from that frequency to a lower frequency, is still an improvement. So, yes, in the right circumstance, nutrients can be helpful. And so when we look at biochemistry, what's that? Yeah.
Are you able to get them from diet only?
No. The question is, can you get them from diet alone?
Yeah.
In this circumstance, when we're talking about this degree of problem, diet alone will not be adequate. And I was having that discussion with Edith before. Really, I'm doing more integrative psychiatry, but I'm not a psychiatrist, that I'm doing integrative medicine. Because when we're talking about somebody as unbalanced as the ones we're going to talk about, that just wellness management is not adequate. So we're talking about taking it to a new level. Sometimes I've said surgical nutrition, got to go in there and cut out that problem, fix that one pathway. It's never that simple, but it's much more aggressive kind of nutrient therapy than wellness therapy. So I'm glad you asked that question. It's an important thing to say. So these are the main things that I begin looking for from the beginning of anybody that comes into the office. And I've added things since I left Pfeiffer. I've seen more iodine deficiency here in Ohio. Magnesium's big. Functional hypoglycemia, we're going to talk about that. It's one that's not appreciated. That's where if you have somebody that has fasted for a period of time, they just haven't eaten, and they start to get ill. And it's especially problematic for some chemistry, and I'm going to talk about that. So we're just going to go through the 5 main chemistries, and I'm going to give you examples. So on these slides, to the left is the clinical feature. So what does it look like? On the right is what goes on in the body. So this is where as you start to see people with these diagnoses, is when we say we see chemistry. So explosive temper, that's a lot zinc deficiency. Poor memory is a lot zinc deficiency. I see poor growth and growth delay a lot of the time in retrospect. So somebody comes in zinc deficient, they're relatively growth retarded. That means if they weren't zinc deficient, they'd be taller. Okay? So I give them zinc, and the first thing is it goes to the brain goes, great, behavior improves. About a month, 2 months later, all of a sudden the body goes, great, and they outgrow their dose. So their behavior comes back. So you can see that goes back to chemistry is not static either. Chemistry is in flux. And so, I see a lot of that, like I said, in retrospect. You start treatment and you notice, whoo, they grew. I just had a kid grew 1.5 inches in 3 months. Hadn't grown a year. Fortunately, he was on enough zinc that he didn't really lose a lot of the behavioral gains. But you could start to, if you start asking, it had been 3 months, like I said, but in the last 3 weeks, or the previous 3 weeks, things were starting to creep back in. The question is, do you have to give more zinc? Yes. So that's part of, and so in the care process that I do, I see somebody and then do labs and then kind of refine treatment and see them at 3 months. Actually, that's almost the most important visit. Obviously, it's important to get started, but that's one of the most important because it's like, did it do anything? Because if it didn't, I completely missed the boat. The dose is completely wrong, But usually you see something. But that's very important. Of course, the next follow-up's especially important too because then you get to retest. But you really need to know, are you going down the right path? Because the question is yes, and you see growth, you just increase the dose. I mean, but it's very important to think about this as a conversation over time because it's not just a quick fix. And you see poor wound healing. Acne is a big one. It's one of the ways I usually get the teenagers to take the zinc. You know, guys, you want to be bigger, stronger, and faster. Yeah, okay, well, take your zinc. I can guarantee you will be. Well, it's true, you know, because I can guarantee they'll be as big, as tall as they will possibly, you know. And then girls, if they want nice skin, I hate to be so, this is not vain per se. Hypogesia is poor taste of the tongue. And so eating is another example of how zinc really affects things. When you help someone zinc, their appetite usually for healthier food improves. Okay, so if you don't taste very well, the healthiest foods aren't the most stimulating from a taste bud standpoint. All the bad foods are fatty, salty, sugary, you know, all sorts of toxins in food. Those are all the ones that set off the taste buds. So if you give zinc, then you can ultimately usually incorporate better diet. White spots of the nails is the sign you can see. So you can see it on the nails. What happens? Zinc's important for GABA. That's the big thing. It's also very important for copper balance. So when we talk about copper, when copper's out of balance, zinc is usually out of balance. So that's, again, you can't just do one treatment. You have to think of both. And it's a defense against oxidative stress, important thing we all need to be thinking about. Environmental toxins are pro-oxidant. So bad things in the environment, stress, good and bad, but emotional stress is pro-oxidant. So if we think about that concept of rust or free radical damage in our body, we're really trying to bolster defense, reduce toxic exposure. It's a lot better to not toxify than to detoxify. Same thing, it's a lot better not to take on oxidative stress than it is to have oxidant defense. It's much better not to take it on. So, copper excess. Like I said before, these are the kids that have hyperactivity. And, you know, these are the kids that just can't sit still. They run around the walls, you know. They're just moving. Temper tantrums are common, and because of the negative effect on the brain, these are the ones that actually can have a lot of learning problems. It turns out that in the brain, copper helps dopamine become noradrenaline. Dopamine is the system in the brain that's involved with movement and learning. It's what most of the stimulants work on. So you can imagine that if you have a deficiency in something that, you know, we're trying to affect in learning, we have problems, and that's what we see. Tinnitus is ringing in the ears, but the key thing is depression, and you can see this also in women, especially women that have postpartum depression. They almost always have high copper. Pregnancy. The question is, where do you get excess copper? Well, genetically, some people are more prone to not tolerate it well. If your zinc is low, then you're not processing your copper right, and then you can be ingesting copper. If you have copper pipes, you have small amounts of copper in your water. And then certain kind of chemical treatments actually increase the dissolved copper in water. So that's the big thing. And the majority of commercially available multivitamins have copper in them. So that's one of the things that we really look out for, is make sure that we're not taking extra copper. And pregnancy is a high copper state. You need copper to make blood vessels. So it's really good in pregnancy to have a lot of blood vessels made in the uterus and the placenta. As you can imagine, it's more nourishment for the fetus. So birth control pills are the #1 cause of high copper in women that are taking them, because it's a pseudo pregnancy state. So it can be mood balancing for some, but it can also increase copper and alter mood. And it's pro-oxidant. So remember, too much copper is bad. So but it's pro-oxidant. So it's something that we want to really be careful of. You know, it's like fire. You want to be careful. Fire's good. A lot of fire's not good. So it's a pro-inflammatory. So the other word, and I forgot to say that before, is inflammation. So oxidative stress causes inflammation, which begets more oxidative stress. So that vicious cycle, those words can be interchanged to some degree. Inflammation, oxidative stress, both bad. Pyrrole disorder. This is the chemistry you learn to see very easily. So these are the sensory dysregulated kids and people. So they have fear and anxiety, and I know those are probably, most people see those as the same symptom, but they're not exactly in the way I see it. because fear is a specific kind of worry. So these are the kids that are afraid of storms, or afraid their parents are going to get sick or die, or always afraid the worst thing's going to happen. So this is like the consummate pessimist in that sense, or consummate hypochondriac in that sense or form. But they have anxiety. Their mood's all over the place. But really, the things that tip them off beyond aggression, mood instability, their anxiety is really the sensitivities. There's the kids that won't wear certain clothes, or that they can't, their socks are so bad that they rip them off and want to throw them across the room, or they cuss them out. You know, tags in their clothes, got to cut them out. Okay, belt's too tight, don't like jeans. I mean, you can sound, covering their ears, or you know, that type of thing. Light bothers me. Headaches all the time because of light sensitivity. Kids, these are the kids also that come home just overwhelmed from the sensory overload of school and fall apart because it's just taking too much energy to keep it together all day. They don't tolerate change well, so the stress. So this is where hypoglycemia, functional hypoglycemia, is really not a great thing, because physiologic stress, and including emotional stress, is really problematic for a person with Pyrrole disorder. So as your blood sugar starts to drop, your first response is adrenaline, terrible hormone if you're an aggressive person. You know, adrenaline, fight or flight. So, and this is also one, these folks tend to have a lot of post-traumatic stress kind of triggers, because post-traumatic stress is not just war, it's a very strong emotional event that imprints itself on your psyche. And because these people overreact, per se, they don't sensory modulate. This is a disinhibited state. They cannot inhibit input. So they get, comes right into their system. They just imprints these post-traumatic events. And then they can trigger problems later. And that, so they're the ones that can have fear that something's going to happen because they remembered how bad it was. And this is especially true for kids on the spectrum. You know, kids on the spectrum that have this, transitions can be very tough. If they've had one bad event, everything that even it looks like it will set them off, because all they can remember is that last event. So, and one of the key things is this low blood arachidonic acid. When the Fiber Treatment Center looked at people with Pyrrole disorder, they found they had low levels of this essential fat in their body. It's actually an omega-6 fat. So we usually hear that omega-6 fats are bad. Well, actually, because they're low, if you give them fish oil, which is omega-3 fat, it sometimes will make their arachidonic acid levels worse. So these people actually get worse on fish oil. Not all of them, but that's a major red flag. If you know anybody that's had fish oil and their aggression has gotten worse or their mood's much worse, very high likelihood that they have Pyrrole disorder. And so they don't need the fish oil now. Well, I try to get people on it, but there's some people I can't even get to take fish oil because their Pyrrole disorder is too bad. I have this, and so I can tell you the key thing is it changes. You know, it's one of the things like Edith was saying, how it changes your life. I was a lot more short-tempered, much more easily sensory overwhelmed. Now that I'm treated, I don't have that as much. So I'm very different now, 8 years into treatment, than I was before. But when I start to get overstressed, some of these symptoms come back. Yeah.
I'm just curious, what's the function of that acid in the body?
The function of that acid, that's actually, it turns into a prostaglandin, which is a signaling hormone in the body. And for women, they really need this in their periods because it's the anti-cramp prostaglandin that they make during their periods. So women that have very severe menstrual cramps, a lot of the times will have low arachidonic acid levels. And so one of the common things you'll see, and evening primrose oil is one of the main sources of this, you'll hear that commonly recommended for women with bad periods. So it has its purpose. There's others in the body, but that's one of the most common things I'll see. So women that have Pyrrole disorder a lot of times will have more severe menstrual cycles. And it ultimately, over time, can also help the mood change too, not just the physical symptoms, because the inflammatory lesion, well, I shouldn't say lesion, but the inflammatory condition of menses can spill inflammatory markers into the body that affect the brain. Well, if you don't spill those into your bloodstream, you don't affect your brain as much. So again, helping this right helps this. So it's, again, it's interconnected. You know, immune systems in every tissue of the body, blood cells in every tissue of the body, nerves, every tissue of the body. I mean, this constant thing we see together. It's a marker in and of itself of increased oxidative stress. And the big thing is serotonin. So some of these things are inferred. Pfeiffer Treatment Center, before I left, had seen about 25,000 patients treated with these kind of chemistries, and you can look at the history of drug positive and negative response to help get a feel for what's that underlying brain chemistry. So you'll see that people that have Pyrrole disorder seem to respond relatively well to pro-serotonergic type of things. So we can say that they're low in serotonin. Yeah. Yeah, that's mood, and so mood, anxiety, OCD rituals. The other two, so up to this point, you could have had all three. And you can have all three plus one of these. You just can't have the next two together. These are exclusive. So we use blood histamine. So, you know, all the other ones are, zinc and copper are blood test. Pyrrole is a urine. This is blood. But this is generally the very social. In fact, in medical terms, I usually say this is the nurse, the next one's the surgeon. So this is the generally social, nurturing kind of person that can also suffer with anxiety, depression, panic, sleep problems, those type of things. And it's relative folic acid deficiency, because that's the treatment, folic acid, and other things too. But it's easier for me to describe this in a case than to really go over the slide, so I'm going to go on the case. But the other thing that characterizes this is people that really do have a gift, but they're underachieving. High histamine, a little easier to describe. These are type A, people that are driven. Okay, they want to get something done. They'll get it done, no matter what the collateral damage is. Okay? Much easier to describe this chemistry than the other one. Okay? And it's also associated with perfectionism. But the big thing with this one, too, is the addictive behavior. This isn't any behavior any of the chemistries can have to some degree addiction, but this one's really the more addictive personality. So antihistaminic kind of things are addictive. So things that are antihistamine, because this is blood histamine. So one of the really bad drugs of abuse is cocaine for this group, but Benadryl can do it. Other drugs that have antihistamines. This group, on the flip side, remember, chemistry confers positive and negatives, and I've been concentrating somewhat on the negative, but these people are relatively tough as nails and get things done even when they're ill. So they're, you know, that's one way to look at it too. So the cases. So, and these are all cases that I had while I was at Pfeiffer. And so this is a kid that I remember. He's 5, violence, homicidal threats against his younger brother. Just came out of the blue 4 months prior to the appointment. No apparent trigger. He was always saying that his parents were trying to harm him, but he repeatedly said they were going to poison him. 10 to 20 tantrums a day, and it got really bad. He threatened to kill someone, usually his brother. He broke things, beat up on his brother. His past medical history really doesn't have much to tell us. PMH, that's what that is. I mean, he did have a little speech delay, but it resolved with speech therapy, and he was normal at the time that this had occurred. And there's no history of psychiatric illness in the family. He had essentially a normal workup, and his EEG was not seizures, because you could think that out of the blue he had a seizure and beat on people. Nope. Nothing wrong with the scan of his head. So he came to see us. And so, and I put the quote from his mom that was in the chart. You know, if he were an adult, he'd be in a straitjacket to restrain him. That's how bad he was. And when we started looking at the way we look at things separate from the traditional criteria, so I kind of broke the first history into traditional kind of history, and then kind of this integrative history piece. He had Jekyll and Hyde behavior, so he just flipped based on if he was hungry or not. So that's that functional hypoglycemia. It already gives you a hint that he's going to have Pyrrole disorder. So he's intolerant to stress, same thing. But what was interesting for him is he didn't have the sensitivities to light, sound, smell, or touch that usually you'll see. Those are almost the sine qua non. And so when we look at it, we say that he had mood swings, he had anger and rage, fear and paranoia, which those are all goes along with Pyrrole disorder, and that's what came up on his test. And it turns out that if your Pyrrole level is elevated, usually your zinc level is low. So Pyrrole confers a risk of zinc deficiency. So although this is much more severe and unstable rage, some of that explosive temper comes out of the zinc deficiency too. So that's kind of the unfortunate negative synergy between these two things. So what we diagnosed him with was Pyrrole disorder, zinc deficiency, and hypoglycemia. And so what happened? Well, after he was rage-free for 6 months when we saw him at a year. They didn't come up at the 6-month visit because he was doing well enough they didn't think they needed to come back. But he was rage-free for 6 months. You know, his tantrums were better. He didn't threaten to kill his brother anymore. Defiance was better. But, you know, he definitely needed to come back because with readjustment of his nutrients, we could see that after 2 years, he was happier. Again, what we're trying to get back to is, you know, a kid that actually feels better and functions better. So he was happier. You know, his behavior was improved. Still had occasional outbursts, but rare. You know, his stress tolerance was better. And, you know, you can imagine that had he continued on the path he was on, he would have had an IEP of 504. He didn't need it. So his life was changed. I remember this patient, 17, anxiety, suicidal depression, very, very short temper. Continued to have gestures of suicide. Cutting was the big one, despite treatment with traditional meds. She was oppositional defiant, had anxiety and panic, getting worse even on meds. And there's a lot of tragedy in her history. Her dad had abused her, and her depression came on when he died. So she was undergoing psychotherapy and psychiatry, and if you look at the traditional diagnoses, you know, she had depression, anxiety, ODD, so oppositional defiant, and post-traumatic stress disorder. The poor kid was very troubled, and she was just brilliant. She had allergies. She was irritable with fasting. She had sensitivities, light, odor, and touch. Internal tension with ritualistic behaviors and very significant fears and paranoia. And so we just, like I said, we listed those things, and it came out that she had a very elevated copper. That's where a lot of the agitation came from. Very low zinc and elevated Pyrrole disorder. She also has elevated histamine. So remember I told you about those people that are kind of, you know, my way or the highway. Yeah. And so, you know, it's just all those things come together to make a very troubled young lady. And so she had Pyrrole disorder, zinc deficiency, high histamine. She also had hypoglycemia. And so 2 months on treatment, this is the email we got. Happy days are here again. She's back to her old self again. Paranoia completely gone. And she's back into the sweetie pie she always was. And this was on the preliminary treatment. This was on just the nutrients I gave her at the visit based on a clinical guess. Now, the classic part of this story is also the fact she stopped, which is what she did at 6 months later. High histamine is very terrible for compliance. So she quit taking it. You know, of course, everybody said, don't stop. And she relapsed in 4 weeks. Fortunately, she recognized it and she got herself back on the nutrients. She refused to take the meds, you know. So fortunately, she did take the nutrients and they helped her. So she was very lucky because coming off Effexor is very difficult. It affects 3 systems in the brain, 3 neurochemical systems in the brain. So it's very habituating. So she's lucky she didn't get a lot sicker with just the cold turkey stopping the meds that she did. But fortunately, she was back on track. She stopped all of it. She stopped meds and nutrients, and in 4 weeks relapsed, and then recognized it, thankfully, and started her nutrients because she didn't want to take, not the meds. She didn't want to take the meds. Yeah, she didn't actually need the meds. You know, fortunately for her, I guess if she was to stop, she did it soon enough so that she could remember what it was like to be well. Because that's the problem. Like when I treat a lot of people with allergies, I don't do it as much now, but when I was in traditional practice, I'd ask them, I'd take the history, and I'm like, man, you have allergies. And they're like, I don't have allergies. And I'm like, oh, you got to be kidding me. So here, take this, take this and come and see me in a week. And they come back and I'm like, oh, I never could feel this good. Because they didn't know what it was like. And that's the challenge, especially in mental illness, is we don't know what it's like to be well. And society doesn't reward us for mental wellness. Rewards us for mental illness. No time for herself, no time to slow down, never turn the TV off, never turn our cell phones off, just down the list. And so, people just don't know what it's like to be well. This is somebody I saw at 11 years. So the early visit I extracted from the chart, but I had the conversation with him when I saw him at his 11-year follow-up. Okay, so he was 17 when he started, newly diagnosed with seizures, distractible, inattention, fatigue, and he didn't want to go to school. Didn't want to go to school, and he couldn't survive. He just couldn't make it. And Tegretol, was just significantly sedating and caused irritability. And his forgetfulness and ADD just means he couldn't do it. And so he had a history of depression, other things in the family. But he came to us with, clearly what he had, which is seizure disorder with ADD. In his sense, really, we can get that idea that it was really a deficit of net attention disorder, especially when we see what happens to him. But he was an even-tempered, well-liked kid. So I wanted to make sure I put in kind of as much as I could the contrast between high and low histamine. This kid's low histamine. Well-liked, artistic, but just a wonderful, well-loved kind of guy. But had terrible short-term memory, some perfectionism, not too much. And so he had obsessions, as we talked, socially oriented, underachievement. That's the kind of the key word for him. So he had a normal copper, a very low zinc, interestingly low normal pyrrole, but clearly low histamine. And so he was treated mainly just for zinc deficiency early on, because you don't treat everything all at once, number one. Histamine takes longer to treat, so you tend to treat things in stages. And follow-up is important. Sometimes histamine doesn't matter. Sometimes the chemistry we find it's not clinically relevant. Again, it's where the rubber meets the road for the person. So 6 months, significant improvements. And he was doing so well, his primary care doctor decided to stop the Tegretol. Didn't have seizures. And because he didn't have the Tegretol, he didn't have the negative effects of the Tegretol, so he actually was doing better. 2 years, he had maintained his gains, but anger had emerged. His extremely low zinc was a hint that he had Pyrrole disorder, just the test didn't show it at the time. And so he was treated for Pyrrole disorder and got better. 3 years, depression, distractibility, inattention came on. He had already been seen as low histamine. He was doing well before. Clearly, at this point in time, his low histamine needed to be treated. It was. He responded. And I saw him at 11 years. Okay. So 11 years later, so he was almost 30. Owned his own business. Doing fantastic. Fortunately, I had plenty of time to talk to him. I didn't have to do much of a physical exam that I needed to do. It was just like refill his prescription to some degree. But it was really a chance for me to see and talk to him how it changed his life. And, he has said this, and a number of the other adult patients that I treated also have said this. You get better over time. That gets back to that concept of temperament. As you start to get stability, it just trickles through your whole being. And that's what's really happened for him. Now, he knows he can't stop his vitamins because he tried it several times and he got worse. But he's low histamine. Very likely, and most of the time, low histamines will never stop their treatment because they've never felt this good. He stopped it a couple times because he thought he might save money. He didn't want to stop because he wanted to stop, but he just wanted to save money. He realized that was a bad choice. But, yeah. So, mental wellness really requires commitment and action. So what do we do? This is a hard slide for me to look at. to tell you the truth, because of the bottom. After what I did to myself in med school, I'm still learning this. So practice self-love. It's one of the big things that we need to do for ourselves. Treat ourselves with compassion. We deserve our best effort to take care of ourselves. And the unfortunate part and the hard part I said is that our kids learn from us. So if we want to help our kids, we've got to help ourselves. So what can we do? Rest and exercise. We're a chronically unrested culture. The electric light is partly to blame because we don't fall asleep when the sun goes down and we don't wake up when the sun comes up. We alter our schedule to fit whatever our perceived need for our schedule is. So if we took the other commitment to say, okay, we need to get our 8 or get our 10, whatever our body needs, and adjusted our schedule around it, we'd be a lot more effective. So we can do that, we just have to choose to commit to it. And electronics are a big problem, not just the light, but electronics themselves, because they're very activating to the brain. What we're talking about in sleep, sleep is restorative. Sleep is quiet time. And we need the rest to recover. But we need the physical activity to, actually stimulate normal development in the body too. Nutrition, that's one of the big challenges right now. Food has been engineered to get us to buy it a second time. Not necessarily nutritious. So again, we have to eat healthy. And if we're in balance and our biochemistry is balanced, then healthy food will feel healthy to us. The other is once we get off our unhealthy food, if we re-challenge a healthy system with it, we'll get sick. The problem is a lot of the times now is the withdrawal from an unhealthy nutrient lifestyle is tough. So we have to get through that craving, especially sugar. That's the biggest challenge. When I talked about, addictive chemicals, nicotine, cocaine, heroin, white sugar, they're almost all the same because you just crave it. What happens is you get a very rapidly absorbed source of sugar. You get a sugar buzz, but you get a sugar crash. And you do it again, you get a sugar buzz, and you get a sugar crash. It's that spike, which is the addictive piece of it. Same thing with nicotine. So that's the problem with sugar, is it's addictive in and of itself, plus all of the negative habits that it has, negative things it does in the body too. But itself is an addictive substance. So, and caffeine, it's my biggest challenge. That's a big problem. I wish. Environment. And so, we can think of environment as, the world, but we can think of it, not only in the global terms, but our immediate and near environment and our environment as we make of it emotionally too. So, and the biggest challenge is electronics, and Edith was talking about, wanting that positive stimulus, from the video games, from tweeting, from Twitter, from Facebook, from texting. It's just all false energy. And we were just talking about, we really need to talk about how negative that is in a developing brain, let alone how negative it is in a developed brain. And fellowship, it's, what has, texting, what has done? What has that done? There's no fellowship. They text each other in the same room. Well, we use your mouth, give me a break, it's like we'll call you in the opposite room rather than get up and say, hey, what's going on? It's just terrible. And it's not that extreme, what I just said. It happens. And so that's really the shame. And we've lost the power of our faith communities, too. It's really sad, Fellowship is spouse to spouse, family, that type of thing. And the greater piece. And often, the key to happiness, people talk about, if you really want true happiness is you give to others, So when we look at a child that's challenged with, unsuccessful lifestyle, however we want to choose to say it, learning challenges or something, you have to build your team. We're all going to burn out. One kid can do it to us. Two kids can do it to us. And I have a number of families in the practice that have two kids that are both on the spectrum. That's a lot of energy, And even the normal kids take energy, So we need our families, we need friends, and we need like-minded people. We need like-minded professionals. And there are different ways we can approach the needs of a kid in need. And that's why I put in some of the professionals. For us, spiritual guidance, though, into teen years, some of the healthier, teen groups provide a healthier spiritual guide rather than the mass. We don't want our kids to be lemmings, and integrative medicine is in there. But massage, acupuncture, I can't put all of the alternative medicine things on there, but there's a number that could fit. And what does integrative medicine do? Well, the idea is really to name what's going on. So we talked about, trying to determine, what's the diagnosis or what systems are broken. So let's identify what's really broken, and think of it in greater terms. If our bowel is having problems, it may not just be the bowel. If anybody has irritable bowel syndrome, they know what I'm talking about. If you get really anxious, you can have diarrhea, So it's not just your bowel that affects your bowel function. It's not just your appetite, And we do all sorts of things when it comes to appetite to de-stress, which has negative consequences on weight gain, too. So, let's look at all the systems. But the goal is really to restore normal function and then protect us from re-injury. So that really gets into that concept of where I was saying before in kids. If we can get their biochemistry in line so that they can access, other therapies or family, or job or something else, then they actually can hopefully find a group of friends to keep them well. Because mental wellness is contagious, which is a good thing, Edith told me, you just say happy, 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 happy. You've already in that instant altered your neurochemistry for a period of time. Now, it's too bad I couldn't just do that and it would last for 3 months, But, it's this. But in this moment now, when I melancholy, I can affect it because I can just do that.
Which may have a different outcome. May give you a different outcome in 3 months.
That's true. It might give me a different outcome depending on what my temperament is at that time. But the idea is we want to be able to provide to, restore normal function, protect us from falling back into ill health so that we can actually thrive. That's the idea. We're not just disease-free. To some degree, you just hear about, unfortunately going to some providers and saying, well, nothing wrong. That's good. Well, nothing wrong isn't good enough. Are you thriving? Are you enjoying life? Are you happy? Are you productive? And so the other part of integrative medicine is what else could be going wrong. So some of it is of the things that are going wrong, what could be biochemistry, but the other thing is we have to look to see what else is going on. And when I look at attention deficit disorder, at autism, kids that have learning troubles, I'm looking, do they have troubles with auditory learning, visual processing, motor planning? Those are big pieces. If you have one sensory system affected, then you usually have another also. So there are ways to help them be more efficient at using their senses. That's the way to think about it. So if someone's having an auditory processing problem, they're expending a lot of energy to process auditory input. And that energy is being stolen from other parts of the brain where they could be using it for other things like behavior or development or whatever. But the idea is we need to look at what else is a problem. Sleep, major importance. It's one of the first things I'm really probing for in my visit is to see if the kids are sleeping, because if the kids are not, the parents aren't. And so I already know that the household is exhausted. So, sleep is a big thing. And then anxiety, as I said, I think it's underappreciated. And really, to me, I don't necessarily need to put this as a core morbidity because to me it's one of the things I look for all the time, and that's what chemistry does. But there may be other causes of anxiety. Mood disorder, so depression. And aside, for me, bipolar NOS, which is the way a lot of the kids with rage are diagnosed, mood lability and rage, about 95% of those kids have have Pyrrole disorder. So for me, when I hear about a kid with a diagnosis of bipolar NOS or it's being entertained, they have Pyrrole disorder. Can I get that straight right now? But they can actually be helped dramatically with nutrients. It's one of the easiest things to treat. And how do we do it? Well, I try to address, as I said, several things at once. What order we do depends on what the need is. Sometimes dietary change will be important, but one doesn't have the energy for it. So you treat the chemistry so that you have remnant, you can recover some of your energy so you can make the dietary choices that ultimately be long-term. So somebody that's really raging, really irritable, very sensitive, you got to fix their Pyrrole disorder. In fact, Pyrrole disorder, if it exists, needs to be fixed first, period, because it confers intolerance to change, intolerance to stress. So you need to recover some ability to actually get well. Even good change is stressful. So bad change is worse, but good change is stressful. So we need to fix some of the impediments to climbing out of that hole too. So, but at least in my world, so Pyrrole disorders first, zinc goes along with that too. But there's other things that we can use. Once we have the biochemistry out of the way, then we can do dietary intervention. We might need pharmaceuticals. And my experience has been that when pharmaceuticals are used with nutrients, you need a lower dose. Okay. So a lot of the schizophrenics that I had treated in Pfeiffer, at Pfeiffer Treatment Center, were on meds. They continue their meds. We start their nutrients. In 2 to 3 months, a lot of them would call back and say, the vitamins are making me tired. It's actually, they were more sensitive to their meds, so they actually could start to come on down on their dose. So the key thing is to look at the positive and negative effects of anything that we're doing. We get back to understanding it. So, and the last one, expect new insights along the way. My common prayer is that the Holy Spirit will give me tomorrow medicine today, because there's always a new challenge. And digestive wellness, these are things that we can do to help ourselves and, attempt to eat right. There's some other suggestions on the next slide, but eliminate things that are potential allergens. And the most common ones are gluten, casein, soy, and corn. We need to stool every day. We need to make sure we digest our food. Fix imbalances. I guess of all the things on this slide, the two most important are drink pure water and chew your food. Okay? So there's many suggestions here, but nothing is as important as actually chewing our food as thoroughly as we can so that we can actually completely digest it and thereby absorb the good things from it. But nothing can grind up the food mass as well as the teeth. And it takes a lot of energy to actually take whatever we eat down to its root digestive piece. So why waste our energy when we can expend it efficiently? And health begins at the dinner table. And this reiterates some things, but the main thing is really the fellowship piece. It's the point where we reconnect with family, we go over our day, we learn experiences, we get to tell our kids stories about, their aunts and uncles, and their grandparents, and then of course when we're over at their place, I get to tell them about us, but, but that's life, I still remember, those are my favorite stories. My dad has 9 brothers and sisters. Yeah, and I heard all the stories, all the time. And then he had one of his cousins come over once, and I heard all sorts of stories I'd never heard before. And he was very nervous. But it was great. We had a great time. And so some places you might turn. EWG.org is a beginning place for people that want to find out about toxins in the environment. They have 2 lists you should print and keep on your person. The Dirty Dozen and the Clean 15. Dirty Dozen are things you should buy organic. And the Clean 15 are the things you don't have to necessarily. So it's a way to save money at the grocer. And then ChooseMyPlate.gov is a much better way to look at eating than the food pyramid. So you can just look at it. It's a plate. Half the plate's fruits and veggies. It's a much easier way to conceptualize how we should eat. I'm not a big fan of dairy. They have a dairy on there, but we can always find a dairy substitute. I recommend a lot of people drink coconut milk or hemp milk or water. And then some books. And then as you see on the bottom, the Nurture Heart approach. Because that's as life-shifting as what we're talking about with the chemistry. You know. I think that's it.